Okay, I'm going to start capture and pan my audience. And there's 1, 2, 3, 4, and I'm 5. Yes.
Information sheet.
And this is for Eugene.
Epidemics. These are diseases that occur in a very vast number. In modern days, we have a form of epidemics called diabetes. We are going to discuss a bill which is in proposition in the House of Representatives, bill number HR 1274, which is proposing easy access to diabetes education. At the moment, I'm going to explain to you the different forms of this bill, how this bill is going to help increase longevity, how a similar bill of this sort was instituted in Australia for a test phase and the results, and how the system is as of now without this bill. We will dive to tell exactly how this bill works at the moment. At the moment, insurance doesn't cover diabetic patients, and other health providers have problems covering this, so this makes a very high amount of income to be imposed on the people who have diabetes. According to the Central of Disease Control and Prevention, the amount of money used by the Americans in 2010 for healthcare on diabetes is $116 billion US. And this was in Dr. Boren's in 2009, cost and benefit associated with diabetes education. We are going to see that reducing of costs, the best way is self-management. The disease has had many medications in the years going forward and back, and we've had oral, insulin, and other forms, and there are forms where you don't have to use medication. A study conducted by Dr. Kent shows the different complexity gotten from diabetes. Diabetes itself leads to other complex forms of diseases, blindness, hypertension, and in very acute form, amputation of the limbs. We will now discuss the program which was made in the rural areas of Australia, the results, and how this has proven that the bill we're about to propose will be a good one in helping diabetic patients of this community. The study was conducted in the rural areas of Australia, and this was done by Dr. Kazak and his colleagues in 2008. Does intervention of diabetes improve glucose level in type 2? This study showed that consecutive visitors to the education system that was instituted, their diabetes level or glucose in their diabetes was at a minimum compared to those who went maybe with 2 treatments and 1 treatment, and those who did not go at all and diagnosed later. The bill which we have now in place, which included diabetics in the Medicare system in 1997, does supply a little bit of reimbursement on the supplies used by the diabetic institutions, hospitals, and personal educators. But there was space left for reimbursement to the educational section of it, and people taking care of this section. What we are going to do with the bill which we have now, which is the introduction of Bill HR 1274, is to ensure that the restrictions which were placed on the former bill, as explained by Dr. Pharmacist Leichter in 1999 in his Business of Diabetes Education, before and after Medicare regulations, will show that if we do rectify some of these problems, we'll be able to have a better future in case of diabetes. Rectifying, what do we do? if we are able to make sure that the development of the educational system is furthered, that will help archaic methods of education. It will reduce the stress on the educators, so as reducing the stress on the patients who go to the educators for education. How this is better rectified in Medicare, we'll go to the reimbursement section. The money which these patients would use to pay for the education, if reimbursed, will be able to go to their private use in buying medications and other amenities which they need. In conclusion, we see that the barrier which we have, this bill, HR 1274, can break this problem. In that, we already have a working system, or a tested working system, which was shown in Australia, rural areas. If we're able to institute that in the American system, we'll be able to do things better. We also see that the system we have has some lacking, and we will try to focus on this system. We see that if this bill is instituted, we will have a little bit of longevity on the patients who have diabetes. I would like you to look at the graph which we have behind. This is showing, in 2011 was conducted by the Center of Disease Control and Prevention. This is showing the rate at which diabetes has been expanding in our population. From the 1980s to 2010, you can see it's going at an exponential rate. In begging for your support for this bill, if we are able to pass this bill, we will be able to reduce that trend, that graph. We will be able to make it to dip down a bit. We already know that at the moment, 26 million United States citizens have been diagnosed with diabetes, and it is showing that there's a proportionate of it by 2050 being half of the population of the United States. I urge on you to get in contact with your senators and congressmen to be able to pass this bill so that we will be able to see that this epidemic of diabetes is curbed as fast as possible. One person, I say this because I have a mother who is a diabetic patient, and I know the problems that comes with diabetes. Thank you very much.